Well, hi everyone. Paul Wright here. Hope you're having a great day wherever you are in the world. Tuning in for our Ask Paul session Q&A. Can I just get everyone to just type a message into the chat box there, just to make sure the audio is working okay and you guys can all hear me. It's difficult when you do these presentations, you don't know if it's working or not. Well, Tim sent a question in straight away, so Tim's on fire. All good. Helen Mack. Is that Helen Mack from beautiful NZ? Have you stalking me, Helen? Or you got nothing better to do this afternoon? Or is that another Mac? We'll get to your microphone in a second. Tracy, hello, Tracy. Gee, it's a cast. It's a cast of thousands and lots of familiar names. That's good at hearing. Yep, working. Gary, good to hear from you. Hello, Sarah. Up there in beautiful North. I hope you're going to the conference. We'll talk to you shortly. Can everyone make sure also, looking through the list, that you've got your microphones turned on? Oh, there's another Helen Mack. Okay, I've got a Helen Mack who I work with in New Zealand, so we've got another Helen Mack on the call. So not stalking me, that's okay. Maybe tempted though, Helen, there's a problem. All right, so make sure you've got your microphones turned on, because the idea of this presentation and then today's Ask Paul was to get more interactive, to get you guys involved in this, and it's always interesting where these things go, so anything could happen. So let's see what happens. So the basic idea, we'll go for, at this stage I've got an hour or so scheduled aside for this. We can go a little bit over if we need to. A lot of you have sent questions in already. And we'll get to those, but I'd prefer to get them asked on your microphone as well. So we might get started. Now I'm gonna throw a lifeline out there first. Now I've got Ted. We'll see if Ted works. Now Ted did send me some questions before, and a list of questions. So Ted, if you're okay to go over there, let me unmute you and see how we go. Ted, how are you? Can you speak into the microphone for me? Ted, you're none from one. I can't hear you. You're off to a great start, aren't we, guys? Let me try also. I've actually got Ted's question in front of me while Ted sorts out his microphone issues. Ted's question was essentially sent me over the key ingredients for a productive website. So Ted wanted to know the key reasons for a productive, or 10. Or the key ingredients of a productive website. A couple that I think you really should have, and it's worthwhile writing these things down. I think you must have, when you look at really good websites, make sure you've got a benefit-rich headline. So I'd be writing that down first up. One of the things that a lot of health businesses' websites miss is any sort of benefit or headline. They've just got the name of the business. You see the better websites now that are out there for health business owners. They have benefits and they have some sort of a headline. You know, is pain holding you back? Having trouble with knee pain? Worried about missing school or sport? So look at what your ideal target market wants, and then try and adjust the headline around. Look for a real benefit-rich headline. So you've got to have that. And I think a lot of them also, you should write this down, they don't have great call to actions. So they've got to have call to actions. What that means is a phone number, a contact us by this method. So making it very obvious how people are supposed to contact you and making that very, very clear. Obviously the phone number, and a tip for you to try and have the click to call function on it, which means when they go to a website and they look at it on a mobile device, try, if possible, for the mobile device, they can just press the screen on the mobile device and it'll ring you up. So it's click to call function. So making it very mobile friendly. I'm moving also quite a lot, obviously, to online bookings. So that's one issue, one thing we've got to look at, making sure you have a mobile a site that has online booking function. And I'm playing a lot too with chat functions and other popovers at the moment with most of my private clients. So looking at ways of getting more interactive with your database. One guy you should have a look at, and I mention this to all of my clients, go to burlesonorthodontics.com, B-U-R-L-E-S-O-N, burlesonorthodontics.com. I interviewed Dustin for Profit Club a little while ago, and Dustin's got a great website. Check out his site, but also have a specific look at the questions or the little interactive part of his website. You've got to fill in some questions about whether you are suitable to Burlington Orthodontics. Really great thing. You type in, yes, I need this, and of course it comes out, yes, you are ideally suited to Burlington Orthodontics, but it's a great way to interact. I love what he's done with your site. So check out Dustin's site. All right, what else have we got here? Let me see. I've got a couple of people saying they've lost some audio. Can you send me some message, some guys that have got audio, and make sure that you guys are still hearing me okay? A couple of people said they haven't. Rob and Tanya came back with no audio. Loud and clear, okay. So it's all okay, so we're back on track. All right, let's go to a couple of questions. Let's see what we've got. Now I've got, since Ted hasn't worked, I'll mute Ted again. He wasn't very useful for me, so good on you, Ted. Now I know Bo sent me some questions. Let me try if Bo's, oh no, Bo's gone offline. We've got a message from Tim. Let's turn Tim on. Tim Pritchard, are you on the call?
Yes, I'm on the call. Can you hear me?
G'day Tim, how are you?
Hi there. Good, thanks, Paul.
Now, how's the interactive nature of this? So my web guys are always telling me to get out from behind the computer and meet the people. Now, I don't like travelling much, so this is as close as I can get at the moment. So it's good to have you on the call.
Fantastic. We appreciate it. So greetings from rainy Hampton, Bayside, Melbourne.
Wow, yeah, it's pretty miserable all around. So Tim, you had a question about Shockwave. Do you want to let me know what? Fire away. What's the question, so everyone knows what the question was?
Well, I'm curious to understand your sentiments regarding shockwave therapy, the radial pressure device that's available through a couple of different avenues and suppliers. They can be pretty pricey, so they're up to $18,000 for the investment, yeah. And you can hire, purchase or lease. However, it's obvious that it's necessary to charge a fair whack to each patient for the benefits. It is one of those wow technologies that not only provides all the bells and whistles and things that go bing, but it does in fact seem to produce some therapeutic benefits of quite revolutionary significance.
Okay.
So I'm just curious as to whether you've looked into it, whether you have it in any of your practices, and or whether you feel as though it's a good investment, like you may have used the gate scan to some benefit you've talked about in the past.
Yeah, a great question. Firstly, what you've got to look at with any investment of a product that you're going to get into your practice, Tim, obviously what's the likely return on investment for it? Obviously that's an obvious question, but and one of the things that you've got to look at, and one of the things that I found that I liked, and I've talked about computer orthotics quite a lot in the past, and we had an opportunity when we had our practices to look at a computer-generated orthotic program that did the orthotic system compared to postural assessment techniques. So taking another program that was postural assessment based, and some people look at those and which one should I go for? And I liked the idea of the orthotic program because it gave me a product. So that's one of the things you look at when you're looking at what is the product that this thing creates for you. The posture screening for us was okay as a service, but didn't give us a great product to on-sell. So that's why I do like the orthotics. Now, your Shockwave doesn't necessarily give you a product, but in itself, the service itself can be a product as a standalone. So I like the idea. Anything that separates you from the competition is very, very useful. I've got clients at the moment that do use Shockwave very, very successfully. But having said that, you've got to make sure you take it on with an understanding you're going to market it well. We used our computer orthotics, as you know, for any of our programs. We used it a lot as a lead generator. So it was a great way we could get people to come in and try a service and get something for free. So it was a lead generator for us. It's hard to do that for Shockwave because it's, from my understanding of it, it's not a pleasant thing to experience in a lot of cases, and it's not, how good was that 15 minutes, come back for another 15 minutes. But the unique selling proposition of it, if you've got a database that needs it, and you're satisfied with the technical or ability of it or the technical results of it, if it's going to separate you from the database, it's certainly very, very heavily worth considering. But it does have to be marketed well though. And that means working out why they should use it, what's the major benefit of it, Tim, compared to what you're currently doing, what's currently available. But it's certainly something that I would consider. A lot of practices are getting on board with it, but just make sure you understand the marketing of it. And I would be charging a higher service or price for that program or that product.
Right. It would naturally require a thoroughfare of patients receiving the treatment to justify the investment, so you need a reasonable return on the investment, which needs to be worked out.
What I always do when I do things like this, Tim, I always look for, you've got to look for available market. And this is a lesson for everyone listening at the moment. One of the big mistakes we make, and I talk about it a lot, we fall in love with our product. So you've got to make sure what you're doing here, you don't want to fall in love with the product of Shockwave. You don't think, oh, what a great product, I love it, it's really good, it's going to do whatever it's going to do. You've got to first think, is there a market for what that product does? So you think market first. And then you find a product that can match that market. So don't fall in love with the idea of a shockwave. Don't fall in love with computer orthotics. Don't fall in love with therapy. Fall in love with the population, the market, and what do they need. So if you've got a lot of people coming with these sort of problems that would benefit from it, and you're currently not happy with the results they're getting, there's not a great solution outside that other people are doing. It could create a unique selling proposition for you. Then you'd look at it, but don't fall in love with the product itself. Make sure you understand that there's a market for it, because the two big drivers for any business are available market and available labour, which gets me onto one of the other big values in programs like Shockwave. That, from my understanding of it, it doesn't require a rocket scientist to operate it. So you could train. I'm going to upset some of the technical people, but you can get a relatively inexperienced therapist to be good at it pretty quickly, which isn't as easy to do if they're doing normal hands-on treatment. So it leverages things like any technology that you use in your business. It can decrease what we call the therapist gap. And the therapist gap, from my understanding, how I work it, is the difference in skill level between the seniors and the juniors. And if you've got products like Shockwave or like computer orthotics or whatever else that you can train juniors up pretty quickly at, it makes that therapist much more productive to the business, because you've leveraged them with a great program that can make them technically better than they are quickly. So that's one of the real benefits of technology, which sometimes we don't think about. Depends how many staff you've got, I suppose.
The benefit of a product, or a service in this case of a product, is that the actual product stays within the clinic. It's not transferable with the leaving junior physiotherapists.
Yeah, that's exactly right, and it transcends them. So when they leave, they don't take the program with them. So that's one of the other reasons I like it. The other thing too is, if it's one of the benefits of higher price products like that, it does thin the market a lot. And so you'll find a lot of your competitors might not take it on because of the price of it, which is a double-edged sword. You know, it's the classic reason, Tim, funny enough, why it's a tough gig in some therapies, because most practices are pretty cheap to start. Like it's not expensive to start a very hands-on practice. I've got mates in panel beating, for example, and it's expensive to start a panel beating practice, panel beating shop. You've got all these expenses, but so there's not a lot of competition. It's a big risk, but I think it's so cheap sometimes to start a private practice in healthcare, relatively, to give it a crack, that it opens up the market a lot. Yeah, so I'd look at it. It will, if there's a market for it, that's the first thing you've got to look at. And if you can you get one to try one? Can you check it out in some capacity? You know, if it's a chance of trialing it before you actually take the commitment, that is useful. I know I've got a podiatrist I work with in Melbourne who's got a new program they've given her the machine to try for a few months to see what the results will be like, and it's an expensive product, but she's going to try it for a while and then see what it's worth, see if it works for her. It's a concept in business called MVP, minimal viable product. Can we try something? What makes you think there's a market? Is it because you think from your client base, Tim, that there's a need for this? What makes you think that there is a demand?
Well, I see that there's a need in the general community of all sorts of types of conditions, particularly musculoskeletal, chronic tendinopathies, epiphyseal issues, enthesopathies, and it would appear that some of these become chronic and non-responsive to intervention, and they don't respond well sometimes to cortisone on a longer term basis. So the evidence coming out about shockwave is quite positive and, as I say, revolutionary in its effect. So
okay, so you've identified in your head you think there's a market for it. My other, now I've put a different hat on now. So since I moved into this field, Tim, I moved it more into the business field, as you know, compared to a clinical therapist. So my decisions are very heavily based on business compared to technical or research. Where health professionals typically are pretty slow to take up things because we want to see 50 million research studies before we think it works or not. And sometimes I understand that, but sometimes it makes us so slow to make decisions. You've got to make sure it works, but you're never going to find 1,000 studies to back it up. And I get frustrated with the speed at which we do things, and sometimes it's just too slow. You'd find the person that took up that program and tried it for a couple of years, got their money back. Yeah, they're often the early adopters. Anyway, it's an interesting thing in healthcare. We're pretty conservative. Yeah, let's move on, Tim. I hope that helped you.
Yes, it does. Thank you.
See how we go, but think market first, and same for all you guys out there. The market is you've got to satisfy the market. It doesn't matter if you love this or you love that. The market doesn't care what you want to do. The market will determine the success of your offering, but you've got to make sure that offering matches the market as a priority. So well done, Tim. Right, let's go to Bo. Now, Bo she sent some really good questions over. So, Bo, I've activated your microphone. Let's see how that works. So, you on the call?
Hello, can you hear me?
Hello, Bo. How are you?
I'm good. How are you?
Comprehensive questions. There was a couple of them that were quite long. So let's go to the first one first because it's a real timely one. Do you want to give everyone a quick summary of your question in 20 seconds or less?
Okay. So basically, I'm a women's health physiotherapist, and a lot of my referrals are mainly prolapse and incontinence. And so I find that I've got a high cancellation rate, and I'm just wondering whether it's the service that I'm providing in terms of if it's not pain, people won't come, or if it's something that I can do to try and increase the attendance rate.
Okay, and we're talking from your email, from the message you sent over, it's people are making the booking, but they're not turning up for the first consult. So you're having quite a lot of non-attendance on session one, but from what you said in your message, is that correct?
Yeah, that's right. So they haven't even met me yet, so it can't be just me.
Okay, well, hopefully not. Couple of things first on that, and you hit the nail on the head. It is actually very difficult to sell prevention of anything. We talked in the last caller with Tim about available market. Prevention is a hard sell. So if you're trying to sell prevention to people, whether it's falls prevention, whether it's prevention of fractures, whether it's prevention of future problems, the lack of urgency to people just makes them procrastinate like nothing else. So that points out exactly what you're talking about. People are more inclined to go and fix a pain problem or an immediate problem than to fix anything to do with prevention. So
it's not even prevention. They actually do have incontinence or prolapse, but obviously usually it's a chronic issue. So
yeah, so they've had it for a while. No, there's nothing. Yeah. So there's no urgency, at the risk of using that term in incontinence, but there's the lack of urgency for this person makes them a difficult market to sell to. That doesn't mean you don't sell it to them, but so what I'd be looking at, one thing first, you in your marketing and in your messages, you look at the consequences of them not taking action sooner. So you try and bring forward the consequence. So you're trying to press the emotional buttons. What will happen if they don't fix it now? If they leave it longer, this is what will happen. So you keep building up that. That's in terms of trying to make them move forward with a buying decision, but it's still a difficult sell. But in terms of your cancellations, though, I'd be curious about, first, you talked in your email about whether you tell them about your cancellation policy or not. Do they, when they make the first phone call, are they informed of the cancellation policy?
No, well, I've only just started doing it this week, so
okay.
I wasn't sure whether that's I've got it on my business card, but sometimes they, if they're ringing over the phone, they don't actually get the business card.
Okay, cancellation is a huge issue in all health businesses, but you can actually get around it. What I'd suggest you do first up, obviously, is make them very aware that there is a cancellation policy in place here, and you do it multiple times. So for everyone listening here today, you have to earn the right to charge a cancellation fee. Now, what I mean by that is you have to make it so impossible for the new patient not to know about it that you have a potential to charge it. Now, I'll tell you in a second, I actually don't think you should charge it. My private clients will know that, but you have to have the threaten that you will. So, so the best way, and what I do with my clients, as soon as they have a contact with a person, so when they ring you, when they make a booking to see you, Bo, you have to make sure they know, just to let you know, we do have a 24-hour cancellation policy. If you aren't able to make that consultation, a charge equal to the full consultation fee will be charged. Is that okay? Or a script, something along that. Now, a couple of things in that. You're getting them to agree to it. Do you notice the words at the end? Is that okay? So they're going to have to give you some response on the phone. Okay, I understand. Now, we run busy practices, so we have to give us 24 hours notice, otherwise a cancellation fee equal to the full fee will be charged. There's no reason to charge half a fee. It will threaten, you may as well just say you're going to charge the whole thing, because that's what you would have got if they turned up. Why should you charge less than that? Now, so that's mentioned in the phone call. They agree to it in the phone call. If you do any pre-visit communication, so it's email or if they get a text or something else, mention it again then. So they get another reminder. When they arrive for their consultation, which hopefully they do in this case because they've been warned about it, they're reminded again. Just to let you know, thanks for coming. In your future consultations, we do have a busy practice, so this happens. So they're told again when they arrive at the practice. You'll even get them to sign an agreement to say they understand and accept it. So that's a really good thing in most practices, to have almost like a contract they have to sign. Do you understand? Just say you understand their cancellation policy. Here it is. So they've done it again. Then when they come and make their follow-up bookings, it's mentioned again. When they get a follow-up email, it's mentioned again. It's on the wall. It's on the desk. It becomes impossible for the patient to miss it. So that when they ring up, then, so the next step then is, if they ever do cancel, you obviously know about a cancellation policy. Now, to fast track it for you guys listening today, that sets up the fact that you have earned the right to charge it if you decide to. But I actually prefer at the stage when push comes to shove, you don't actually charge it. Now, that the best way around it, if they ring inside 24 hours, the script I like to use with all of my clients, you obviously know about a cancellation policy. You're required to give us 24 hours notice, otherwise a cancellation fee equal to the full fee will be charged. However, because you're a valued client, if I can rebook you for tomorrow, I can waive that fee. What's the best time for you? So you acknowledge that they were supposed to pay. You're then saying that we'll waive it in this occasion because you're a valued client if they rebook. If by chance they don't rebook, then the admin's taken the call. I'll just get the therapist to give you a call. It's very rare you actually want to even charge that, Bo. So you're mentioning it a lot. You're not charging it. If you have someone who does it to you again, if it happens again, then you could charge them. I get to the stage where I have a discussion with those people and you discharge them. Or the other way around it is you get them to pay in advance. You say, look, you've cancelled a few times in the past. That's not how we run our business here. You've taken a spot of another valuable client. you need to pay 3 sessions in advance. If by chance you fail to attend a session, we take that out of your the money you're in credit. How does that sound? And they might decide to or might not to, but you don't want the person who's going to muck you around like that. That's the cancellation policy I encourage in all of my clients, and I think it works. It works well, because the worst thing you want, guys, for everyone out there, the worst thing you want in your business is to be sending invoices to people who are never going to pay them anyway, and they're never going to come back because they're getting these invoices. So there's a thing in business called bad profits, and that's a classic example of a bad profit. You get some money, but it's not worth it. What I do suggest, though, and be careful of this, you also don't want the situation where your admin team have to decide what's a valid excuse or not. You know, Mrs. Jones rings up and the cat died, and then they had to go to a funeral, and it's just, you just don't want to be in that. You don't want that pressure on your admin team. It makes the job very, very unpleasant. So you're better off removing that, and just the script is the script regardless of the reason. We'll normally charge this, and if Mrs. Smith's cat died, we can reschedule till tomorrow. And if she still can't book in, get the therapist to give her a call. You still kept the relationship going, and I just don't see, you just don't want your admin team involved in the judge and jury decision, because it's the most unpleasant part of their job, and it'll make them, it'll just be a nightmare for them. So that's my preference for it. How's that? Does that give you some ideas to follow there, Bo?
Yeah. No, that's good. Thank you.
If they're not showing, the other reason they're not showing is if they've contacted you, they need to make sure they're committed to it. I had one client who contacted me a week or so ago. He had this issue as well, and we've decided in his case he's going to take the credit cards up front. So when the people ring for high value service, he's going to get them to give their credit card over the phone to secure that booking. It's like restaurants are doing now. No, it's again about valuing your service and teaching people how to treat you. And I think that's a very important part of it. You've got to make sure people understand what's the deal is with doing business with you, and making sure that they abide to your terms and conditions. How's that?
Okay. Yeah, thank you.
All right, let's move on. So any other questions? Go. If you can, there is a section I think on you can put your hand up. Lorna's got a hand up. There you go. So thanks, Bo. I hope that helped.
Thank you.
Now we've got Lorna's got a hand up. Lorna, are you on the call, Lorna?
Hi, Paul. How are you?
Hello, Lorna. How are you?
Thank you.
Before I asked that, was there a little?
I'm very good. How are you?
You could press a little thing that put your hand up, did you, on your screen?
Yes, I did. Yeah.
Okay. Well, there you go. Put your hand up, guys.
I'll put it back down again.
Well, it's up again now. Okay, so Laura, what's your question?
Very, very quick, and it's just the whole thing that you send text reminders and people send back yes, and then suddenly they decide on the day to send back a no when they've specifically been told that they need to ring to reschedule. So you don't necessarily have that opportunity to talk to them, still get your admin staff to give them a call and say, listen, you've sent us through a no, and just run through that whole script again.
Yeah, that's one of the dangers of the reply if you can't make it. Do they actually? So
we don't. We say reply yes to confirm or contact us to reschedule to avoid a cancellation fee.
Okay, and is there a problem for you, or that works well for you?
It works well, except for the few clients who will suddenly say yes the day before, and then on the day we'll send a no without actually bothering to phone. But I guess then it's just for us to follow up. So that's probably already answered itself.
Well, it comes back to Bo's thing, doesn't it? As we talked about a second ago, you have to make them that aware that there is a consequence, and most people don't. Like most health business owners, Lorna, they just don't remind the client enough, and it doesn't become such a fundamental of the business. And I love the idea of the contract. The other thing you've got to, that's, as I said to Bo a second ago, if you can make them sign something like the agreement, the physical act of signing something, you might even have your cancellation policy as a separate document, and that's on your new patient register. If it's ticked off, yes, they've done it. It's just got to become such a. So you want the client to ring up saying, "I know you have a cancellation policy, and I'm in the 24 hours, but." And when you'll know you're doing it well when they start the call like that. You know you've got it. You're still going to have some.
Yep, excellent.
The other thing too, and it comes back to Bo's question as well, because she had in her next question, she had some people not coming for the second consultation. That
yes.
you've got to be. That comes back a lot, and you find it more with junior therapists. You've got to really get into what they're saying in that initial consultation. The words they use. Ivan Frangi, who's a colleague of mine, does a lot of work with customer relations. He talks about proceed, don't continue. What he's getting at is you make so. Now, when I see you on Friday, Lorna, I want to show you this exercise, and check this, because then if you do that, we'll be able to do this. There's a specific reason for you to come back, and I think a lot of reason people why they don't come back to therapy is we'll see you on Friday and we'll keep going. They don't say anything. We'll see you on Friday, and there's no real urgency. There's no real need. There's no real benefit for the person to come in. What am I going to do on Friday? Whereas if you said you're going to I want to do that assessment on you on Friday, Paul, and check that you're running okay, and in that session I'll give you the okay to do the marathon on Sunday. I'm not going to cancel that appointment because I want to get the okay from you. I've got to see you to get the okay.
Yes.
That in itself is going to stop your cancellations. The other thing too for everyone, watch what you're saying regarding the perception that you have lots of time. The old, I've got a 2, 2:30 and 3 on Friday, which would you prefer? Now that's going to kill you. That's going to kill your cancellation rate straight up, because if people think there's options on things, it's not desperate anymore. If you make too many options available to people, they'll think you're not busy enough, and they think it's easy to shuffle. Whereas if, look, I'm fully booked, but I've just had a cancellation on Friday at 2 o'clock. You've got to be lucky sometimes. And that conversation itself makes a massive difference to that person coming to that consult or thinking they can shuffle it and play on their terms. Does that make sense, Lorna? Lorna's mic might have dropped off. Anyway, so that's the guts of that. Make sure, and it comes back a lot to how what you say, how you say it, and it works itself out from there. So, well done, Lorna. I'll put your hand down and see how we go. Rob's got a question for us. No, but Rob, your question, Rob, I think you're offline, aren't you? You want to? Yes, you can send me a question. Do you want to type a question in? Rob, put your hand up. If you want to type in your question, send it over. All right, let's move along. Who else have we got here? Sarah. Then I'll roll the dice here and see if Sarah can hear me. Sarah, are you there?
Yep.
Hello, Sarah. How are you?
Hello, Paul. Really good, thanks. How are you?
What's happening in beautiful North? Now, hopefully you're going to the conference in Darwin. Just up near.
Yes, I am.
Right, we'll catch you then. Now, what's your question as a long-term exponent? This would be good. What do you got?
Just back to the cancellation policy. We actually run Pilates classes with sort of 6 to 8 people, and back to that, they don't have pain. It's a prevention type thing. So when they cancel on the day, quite often we actually do charge them. Are you suggesting we shouldn't charge them and just waive it? Because
I didn't like to charge it for consults, like for therapy consults. Pilates though can be a different, like classes can be a different structure, because it's a different beast. It's not as personal. But what's your current structure? What do you do so you do cancel? You do charge or you don't charge, or?
Most of the time we charge, unless it's a really legitimate reason, like they're a doctor and they've been called in for an emergency or something. Then we say, of course, we'll get you booked in on Thursday.
Yeah.
But there are just people that say, oh, I'm running late from work and so I can't make it, and we say, oh, we know, we have to charge you, and they say, yeah, that's fine, and most people actually understand because they're such small classes.
Yeah, that's an issue. That comes back again, Sarah, to setting the expectation, and that's the agreement they sign at the start. One thing that I would question though is sometimes in these situations I actually prefer changing the payment model. Are you able to structure, or ever thought about changing it to a membership model where they pay a monthly fee regardless of whether they come or not?
We have an agreement where if they book 10, then it's $40. We've got quite a high pricing.
Yeah.
So if they book 10, we charge $40 per class, but if they book per class, it's $45.
What I'm getting at though,
Right.
for example, we've got a client I was working with who she was running Pilates classes in school terms. So she's doing
Yeah.
10-week terms, and the problem she was having is that when they'd finish a cycle of classes, she had to then re-sign them up to the next cycle of classes.
Yeah, we had that problem too, so we stopped doing it as terms. We just do it as book whenever you want.
Yeah, but what we got though was we actually just signed her up. So what she decided, she had so many spots in her classes, she decided to charge a certain amount per month. There was a set fee, so it was a direct debited system. And that entitled a person to come to so many classes a week or whatever classes they came to. So you actually, it's a gym membership model, which is just a different way of structuring it. And then it might be first in, first dressed, but you'll know how many people you've got in a class, how many people you can service, and what the average attendance rate is. I really like membership models, Sarah. As you know, I'm a fan of membership models. So anything that stops someone having to rejoin and repay, and that may be something you want to look at with Aaron, because you're still doing some stuff with Aaron.
Yeah, he's great.
I'd look at that as well as can you structure your Pilates program as a membership model?
Do you have it as a rolling thing where they have to opt out and you just keep charging every month?
Yeah, it's a recurring membership. It's a recurring. They're part of. For example, I've got another client I work with at the moment she's just started she's got a fitness centre attached to her physio clinic, and she's just started a mind-body program, and she started a yoga program. So and we're running those as membership models. So it's so much a month. They can come to the classes. Obviously, a little bit difficult if you've got a limited number of classes of spaces for things, but that's just a matter of knowing your numbers and how many members you can take in. But in her case, if she has a yoga class, they've joined the yoga program, and there might be 3 classes a week, and for that membership, you can come to any or all of those classes for X number of dollars per month. Yeah,
it's a good idea, because we do have spaces in most of our classes, so I think it would be a good option.
Let's look at gyms. I mean, gyms have been doing it for years. When the whole gym model, Sarah, changed when they stopped charging yearly membership dues. The whole model changed. So it was revolutionary. So you just everything's monthly direct debit, and that's while we're doing it. That's actually a model that I actually have seen some chiropractors use in the States. You actually have to pay a membership fee to be to come and see them as a patient. So it's a monthly, and I've seen private hospitals do it. You have to pay a fee every year, every month, direct debited, to be able to even use the emergency department of the private hospital. So I'm a real fan of membership models, Sarah. So if you can look at your business, what can we put into memberships? What can be done as a recurring thing? Then you don't have the issue of someone buying the next 10-pack, which is the painful transaction.
Yeah.
Just rolls over. I'd be looking at changing the model.
Okay.
There you go. How's that one?
Nice.
Well done, Sarah. We'll see you up in Darwin. For those, it's the Darwin Physio Conference. It's the Leadership Conference, 26th, 27th, 28th of August. I think we're up there. It'll be good fun. Well done, Sarah. Now,
thanks,
Rob,
Paul.
talk to you soon. Now, Rob's emailed us a question in. Rob, just want to ask about developing GP relationships for referrals. Are visits to the GP worth the effort? Are letters better? What else works? It's a timely question, Rob. I just did a lecture as part of I did a one-day referral course with a chap named Michael Griffith. And in that day up in Sydney, I did a lecture on how to increase doctor referrals. Letters can be useful. I do like doctor's visits. I've actually presented 10 different models. The one that I ended up favouring, and one that I do favour at the moment, I did with one of my clients, was a direct response campaign. And I'd suggest you think about this. Sending all of the doctors a letter, but getting them to contact you for either to come in for a free consultation or asking for you to visit them. So almost like weeding out, Rob, who's interested in your services and who isn't. I find that's a much better way than just cold calling. There's lots of other ways to do it, but I've been really pushing the lead generation model, which means communicating en masse, getting them to contact you to say, yes, I'm interested or not, and then following up with those who show some interest. It's no different than lead generation for patients. You know, you'll do a lecture on back pain at the gym, and if 20 people turn up, they've expressed they've got interest in back pain. It's the same for the doctors. So I'd think about in your business, what can you offer, what do you think would be interesting to the doctors that would make them want to contact you to express interest? And as I said, clients that I've got, we've used a free doctor visit where the doctors can then send this form back to the therapist and make an appointment to come in for a treatment, so they can free treatment to see how good they are. I did it for years with DVDs, so I'd send them, they can get a free back care DVD. I've also done it with lectures, so I've sent out letters around to local doctors saying that I'm available to come and do a free lecture for your team. Contact us if you're interested in doing it. So it's more the lead generation model. By the way, I'll mention it at the end of the presentation today, but that program, the Ultimate Referral System, it's going to be my end of financial year offer this year. So it's going to be, I've got the packs arrived here yesterday. That'll be the new program that'll be going out, and the big deal will be the end of financial year offer. So that'll be coming in the next couple of weeks. So, but are visits worthwhile? Yes, they can be, but I'd rather someone put their hand up first and express some interest. And then you've got to be very careful what you say and make sure you ask the right questions in that meeting. But it's also a numbers game, Rob. You might get, I don't know, 10 out of 1,000 that are profitable for you, but it is a numbers game, I'm afraid. So you've got to make sure you're on top of your numbers. Right, so hopefully that answers your question. Other questions? Who have we got here? We've got Bruce on the line. I'm going to put Bruce on the spot. Mr. Cohen. Bruce, are you there? No, Bruce hasn't answered. Let me scroll down. Ted's not working for me. All right. Well, Bruce has put his hand up, so you're back online. Bruce, are you with me now? Hello, Bruce. See the wonders of modern technology. If you're having trouble, guys, if you're having trouble with the microphone thing, if you want to pop your question into the question box or the message box, that way we can get to you. So questions, who's got any for me? I've got Bruce's microphone isn't working. Good on you, Bruce. One of your best. Bo's got another question. Of course you have. Let's find Bo again. Where did you go, Bo? You're back, Bo.
Hi.
Was this question 2 of your list?
Yes, it was.
All right. Do you want to give everyone the question, and we'll.
So I work in a medical suite, basically right next to the hospital.
Yeah.
And I've got so many potential doctors, specialist doctors that can refer to me. And I've done sort of like a big pamphlet sent out.
So your mic's dropping out a little bit, Bo. Are you talking into the mic? That's better.
Is that better?
That's better, yep.
Sorry. Yeah, so there's lots of potential referral sources from specialists, even though I've sent out heaps of pamphlets to all the potential ones, and I've offered to go in. I've pretty much got no response, and I'm just wondering if there's anything that I'm missing. Like, I guess the potential reasons that they may not be referring back is because they're not sure why they would. I actually did do a talk in front of gynaes and obstetricians to say, how I can help their patients, but still there's been little response.
Okay, have you talked to, firstly, from what I understand, so would there be any reluctance to these guys to refer to you because you're in the offices of another specialist?
Yeah, well, that was perhaps a reason. Do you think there's anything I can go like around that situation?
Well, it's not ideal, but a lot of specialists aren't that scarcity minded. A lot of them aren't worried about that. It depends. Some of them might be, but generally they're not. We had an example, for example, in our physio practices, we had the physio clinic inside Fitness First. So lots of our practices, but we're inside Fitness First. But we still got lots of referrals from other local gyms and personal trainers, even though we were inside their competition venue. So it wasn't a big deal. So we could get around it. What I'd be interested, though, I'd be interested in speaking to the current doctors, if you can get some meetings with them, and just find out. I'd be asking. That's, as I talked about a second ago with my answer to Rob. Sometimes when we get in these meetings, we just fluff around too much. We don't ask the questions. So I'd be interested if I got in front of one of these doctors. Who do they refer to? Why do they refer to that person? What conditions do you need help with? How can I help you? So being very upfront and outlining very clearly exactly who you want them to send to you. So when so rather than a general brochure, which may or may not get to the doctor anyway, I would want to be in their face and outlining very, very clearly exactly who they should be sending to me and why. And that comes back to pressing the buttons of the doctor. And the biggest button you can press for the doctor is that the patient won't get the best outcome unless you're involved in it. So it's about patient outcomes. Doc, if you don't send them to me, this is what's going to happen. This and this will happen. So you've got to press their buttons, and their button is largely to do with the quality, the outcome their patient gets. So my first thing, I would be, if you know any of these guys, I'd be trying to get a meeting with them and ask them the questions. Who do they refer to? Why? I've sent you a few letters. Have you received the letters? Can I ask why you haven't referred anyone? Do you have any people that would need my help? Maybe they don't. But you don't just send. You've got to get in front of these people to find out that. Now, as I said, if you've only got a few of them, you can possibly arrange that quite comfortably. If we've got a bigger target audience and it's large enough, we could do a lead generation campaign for them. Do you have patients that have this and this? Would you like to know the top 5 reasons why they need to get this and this done? If so, fax back this form or contact us and we'll come and do a free presentation for you. Are your patients at risk? It's that kind of, it's kind of marketing. So anyway, so that's what I'd be doing. So I'd be first be curious as to why they aren't sending. I'd want to get in front of as many as I could, and if that's the case, some will work and some won't. It's a numbers game, doctor marketing, which is out of that 10 or so, you might get a couple, but you can make a very successful practice out of a couple of very good referring doctors, if it's done well.
That's right. Okay, thank you.
Hope that helps. You got both your questions done, Bo.
So yeah, that's right. Thank you.
Well done. Now we've got Bruce has put his hand up again. Now we'll see if Bruce can work at his microphone. Bruce, mate, you're having a shocker. I don't know what's going on with your microphone. Let's get back. I've got Gary on the line. He's got his hand up.
How you going, Paul?
G'day, Gary. How are you?
Good yourself. Paul, just on what you just said, my practice is within a Good Life gym, which is effectively the same as Fitness First.
Yep.
And I'm having the exact opposite of what you said. Like, I've approached other gyms, their personal trainers, and they're exceptionally reluctant to send their clients in. I generally go out to them, introduce myself, tell them what I want to do, postural assessments, blah, 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 and then get the personal trainer in to my rooms for a free session to show them what I do and how I run my business.
Okay. It's not actually the exact opposite, Gary, but it is hard work. You've got to overcome a barrier. So we got around it though, and I think the way we got around it was largely because of how much value we presented to them in our offering. So because I was heavily involved in the education of these guys, I had a reputation and it kind of transcended the concern about them sending to another gym. So my profile certainly helped. If you haven't got that profile, then you might have to modify your approach. One thing you may then need to look very heavily at what else you can offer these guys. So
Well, it's sort of similar to the first guy. I do have a Shockwave.
Okay.
And I got it particularly for that, as you described, a point of difference.
Yep.
So I was basically saying to these guys, look, send them, let them come and see me for Shockwave, and then sort of trying to work that around, and still hitting quite a barrier with the local sort of PTs of other sort of boutique gyms and that sort of thing.
Yeah.
I think my next sort of step is to start targeting PTs who run traditional boot camps or sections within parks.
Yeah, it's a numbers game, as everything is, Gary. So, but don't flog a dead horse. Like if they are that resistant to do it, then look at what's the best use of your time. But it still comes back, though, largely, Gary, to relationships. So if I have a relationship with a trainer, sometimes it transcends where they train their people. So, for example, we would refer people out to other gyms other than to Fitness First. So we were developing relationships, and we were giving something to these other clubs, not just to Fitness First. So it's what's in it for them and how you can help them. So if you were to able to go in and provide a really valuable service, like we'd go into other gyms and physically do lectures for the trainers. So we would and they'd let us in. We'd have a great topic.
Yeah, no, certainly. And I've sort of tried to do that with just a 15-minute postural screen, and trying to do that at CrossFit clubs, at other PTs, and go out on site. And they're more than happy for that to happen.
They were more than happy, or they weren't?
Yeah, more than happy. Loved it. Got really good responses. And then when they sort of delve deeper as to where the actual practice is within the Good Life gym, they're kind of like, oh, guys, I can't send patients there because I'm worried that they're now going to look at that gym and go, okay, I'm going to leave gym Y to go to your gym.
If they've got that strong a scarcity mentality, Gary, then you need to look a different target.
And I guess that's what I have to try. I just want to know, obviously everything you've just said has been ridiculously helpful.
Yeah,
but
like I said, we did it. But my profile probably got me in. They would send to Paul Wright and get active physio, even though we're in another clinic because of the profile we had. But you can, the other thing, look at, you have to get them past that. You might have to do. We said to our guys, we had a guarantee that there would no way would they ever get referred to or inside at the gym. So you send them. If they came to us, they'd always go back to you. So we made that very clear in our agreement. So they were really clear on it. Yeah. But it might take. It's about relationships. It might take 3 or 4 lectures for you to develop that sort of relationship that they feel comfortable that you aren't going to steal their clients.
Yeah, sure thing.
But again, you've got to work out, Gary, is that worth the time you've got to invest in it?
Yeah.
You might be better off targeting, you might be better off going after the other boot camps or ones that don't have established relationships.
Sure.
And that's always one of the questions. Who do you, when you speak to any personal trainer or potential referrer, who do you currently refer to? Why do you use them? So that sometimes they're questions we probably don't ask, but we should. It's direct. Who do you use? Why do you use them? Any frustrations you've had with them? And that's always one of the major things. What's the frustrations that you experience at the moment? And then you go about solving the frustration. Most gyms, if you were to speak to the owner or the personal training coordinator in most gyms, their biggest frustration is going to be staff training. So I just want to how do I get my team up to speed? How do I get them trained? How can and providing more services for them and their members.
Mm-hmm.
If you can provide those things, the fact that they're sending you to another gym, may or may not be an issue. It's depending how much you can get past that, and how confident they are that you won't poach them. But it may be insurmountable. Without that relationship, it'll be insurmountable.
Mm-hmm.
But this is the same. This is the same as everything. Okay, what's the best use of your time, and where's the market? The available market might not be there for you in those gyms. You might be better off in the bigger boot camps.
Yeah, sure.
Yeah, it's a tough one,
Yeah.
But having said that, there's always a solution, but there's always lots of other clients around. You've just got to make sure you're getting valuable use of your time, because it can be labour intensive.
Okay. Thanks for that.
Well done, Gary. Look, Cohen's put his hand up again, and now I'll give him another crack. All right, Bruce, are you on or not?
Is that my coming through now?
Oh, it's not too bad. Do you lean in a bit closer for me, or you're right on it?
Okay. I'm trying to.
That's better.
About that. If
there you go.
There.
How are you, Bruce?
Hi, everybody, and sorry for the interruption so far. It's been really interesting listening.
You've been a nightmare for me so far, Bruce. Now my technology knowledge is not great, and now you've totally kiboshed the whole thing.
Thrown your script out.
All right, you got a question for me, or are you just in for a chat?
Oh no, I was. I didn't know whether you were throwing to me or no. Other than that, just happy listening in, and I'll be seeing you up in Darwin. So.
Hey, while I've got you, Bruce, what's the biggest issue you're finding, because you do a lot of work with other health professionals, what's the biggest issue you're finding that health business owners are suffering from at the moment?
Look, it was interesting hearing a couple of those DNAs, I would call them, or did not attends. I think that's a common issue out there, and perhaps it's busy lives or whatever it is, and all those policies you're putting in place sound really great. I think for us in my other business, we're wearing my IT hat and our note-taking app hat, we're adding an SMS reminder to our program so that people will know when they've got their notes ready to go. They'll be getting an SMS reminder out to their clients. So they don't have any of those. Cancellation
is such a massive thing, isn't it? The other thing, guys, quick plug, if you're looking at, the other thing you need to look at, make sure you've got a very tight system for following up the cancellation with no follow-up call. So it's okay to have a cancellation, and if they've, as a system I talked about earlier, if they cancel and they've got a follow-up booking, they're still in your system. It's the ones who cancel without a follow-up booking, they're the dangerous ones. So I'd make sure you look very tightly at what your protocol is for the cancel with no follow-up person. So that's the person who rings up and I've got a session on Friday and I can't make it, and they fall through the crack and don't have another consult. So that's a real tight one. And if you get that system right, that is actually the hottest, we talk about marketing list, that's the hottest marketing list on the planet, is the list of patients who were supposed to come in but didn't. You should be getting a 9 or 10 out of 10 rebooking rate for those phone calls. So it's vital you make sure that's in your protocol list. And that was one of the systems we put into 1 minute practice, was the cancel with no follow-up list. So it's a vital one. Well done, Bruce. I'll see you up in Darwin, mate. Be fun. Be a fun few days.
Okay, sounds good. Thanks, Paul.
See you, mate. Now we'll probably finish up with one last question. I've got Sarah's come back with a question for us. Sarah, this is about your massage therapist, so we'll give you a crack at it. You still on the line,
Is that
Sarah?
me, Paul?
Yeah, it's you, Sarah. You've sent me a question about your massage therapist. Why don't you rip that one in and we'll finish with that one.
Well, actually, it's about at the end of the year, we're setting up an allied health clinic, rather than just our physiotherapy clinic. So we're in the process of purchasing a building. We've only got limited spaces within the building. So firstly, I'm wondering, have you ever charged a different health professional by a percentage of their billings?
Yes.
So for example, we have a psychologist and we're looking at charging them 25% of their billings, and we supply the admin and the rooms and cleaning and everything else?
Yeah. Yes.
Rather than charging for the room.
Yeah, we've done all that. You've just got to be careful, and it kind of relates into, there's a message I got from David about HR legal issues regarding contractor employee things. Because you've got to be very careful with what you're doing regarding that as a contractor versus an employee deal. So first one is make sure you get the legals right on it. The other question too, and from David, while I've got it, check out the guys at Workforce Advisors Group, David. I've been doing some work with those guys for Neil and those guys, Workforce Advisors. We actually did a DVD on it. We did a session on contractor versus employee. That's on our website, the contractor versus employee DVD. And I think from memory you can get that for a really good deal if you get for Australians, if you want to buy how to run a 1-minute practice book. That's a bonus on top of that. Anyway, so I'd check out those guys, because the first thing that came to my mind then, Sarah, was what was going to happen to you guys legally regarding that. So be careful of that. But you can certainly.
I mean, we don't want to employ them. We just want them to be able to have a space to run their own business. We look after physios, but we want them to run their own business within our centre.
I understand what you're doing, but then you've got to make sure you get that agreement right, so that you're not crossing the grey area of contractor versus employee. So that's the first thing. Second thing is it worth it for you? I've liked the idea. I've always had massage in our practices and other professionals. But there is a time, a lot of my guys experience it, where the returns on it are nowhere near as great as what they get from their core business. So if there's 1 hour massages and they're charging 80, 90, 100 bucks for a session, and they're paying the therapist 40, 50% of it, the margins are not anywhere near as great as you can get from a well-run physio practice or a chiro practice. So you've got to make sure that I always had available space for it though, Sarah. It was reasonable for me to have it. And I used massage a lot for promotions and for upsells and for bonuses and other things. So it can be viable. Just make sure it's a profitable use of the space compared to what else you could put in there that might be more profitable.
I mean, in our town, it's a really small town, so we only have about 2,500 in our town. So we've got 3 physios. So the demand for any more physios is probably not there.
Yep.
So we're sort of looking at diversifying so that we have, an optometrist and a, psychologist and things like that.
I like the model. I think if you've got space for it, then great. I like the one-stop shop concept. As long as it doesn't take away billing potential from more profitable centres of your business, and also doesn't take away your focus, because sometimes you get caught up in spending time in other things. Again, it's got to be worth your time. I've got the guy actually who bought my practices off me. We had the massage department there for ages, and he finally did a profit split deal with another guy. So another guy actually took over the massage department totally and ran it as his own business, and they just do a profit split on it. So the physio runs the physio side, the massage guy runs the massage side, and that works well for them. So it just wasn't worth the physio's time to get involved in all that. And I'm saying discussions I had with Aaron when we talk about his multidisciplinary practice. If he's spending lots of time with OTs or with osteos or with massage therapists, does that take him away from the core focus? Which is why your model of a straight percentage of billings, and they look after their own business, is a reasonable model, or a straight rental, whichever gives you the most peace of mind and the most profit, as long as you are covered legally for the contractor versus employee issues, which is a grey one to be careful of. Yeah.
Thanks, Paul.
Thanks, Sarah. All right, guys, we're going to quickly wrap it up. A couple of things first before we go. Hopefully you enjoyed that presentation. A couple of things to look at first. If you haven't already got your hands on my new book, How to Run a 1-Minute Practice, I suggest you do it. As I said a second ago, the Australians, when you go to that website /book sales, if you get to that page, you can actually order a copy of that contractor versus DVD, contractor versus employee DVD for, I think it's around $45 or something. So it's a pretty cheap deal. If you're involved in contractors or staff members, you need to have that presentation. So that's the 1-Minute Practice book. Make sure also, if you haven't already done so, the Paul's Incredible Gift Offer. That's where I send you over $500 worth of materials for 19 bucks. A lot of you guys are members already. I've seen your names around the Profit Club thing. So you'll get a free How to Increase Profits in Your Healthcare Business DVD, audio CD of Work-Life Balance, Biggest Health Business Mistakes, Website Mistakes in Healthcare, and some great resources there. That's hugely valuable for $19.95. Go to healthbusinessprofits.com and click on the Paul's Incredible Gift. That's a nice way to start. And I did mention at the start of this presentation, at the end of the month, I'm going to be rolling out the Ultimate Health Business Referral Training System. This was a 1-day course that I did with Michael Griffiths, and we videoed it, transcribed it, put all the modules together. I was just finishing off the pack last night, and it's got huge value on getting referrals into your business, All the MP3s are there, electronic copies of the documents, and it's an 83-page fill-in-the-blanks manual, which is what I wanted to do with that program, was to get owners the chance to have their team members to also understand the importance of referrals. So you give them this program, they go away, fill it in and bring it back. So it's getting everyone involved in referrals in your business, which helps you as the owner. There's also the session in there on how to increase doctor referrals, which we covered a little bit today. So there's a video of the live presentation, plus the data disk has got all of my doctor letters, doctor newsletters, doctor templates, the letter campaigns we've used to get doctors on board. So it's a great program, and there's going to be a great end of financial year offer on that program. So make sure you're on my email list and keep a lookout for it. We're putting the final touches to the sales pages at the moment, so that is going to be available as an end of financial year offer. It'll probably go out in the next 2 weeks or so and be available until 30th of June. So it's a great way to finish year on a tax deduction. And if you haven't already done so, check out oneminutepractice.com. We talked about the the cancellation list a second ago. That's a vital part of any practice. We talked about cancellation policies as well, and all that's measured inside the 1 Minute Practice platform. So it's a great program. Make sure you check out oneminutepractice.com. I hope you enjoyed this session, everyone. Any other questions or anything else, please send them through to our email address. admin@healthbusinessprofits.com is the email address that you can get in contact with us. And if you haven't already done so, make sure you connect with me on LinkedIn, and we'll stay in touch. Hope you enjoyed this session, guys. We'll see you next time.